So welcome everyone for joining this webinar on AccuRx, and we're going to do a demo through what's available currently with AccuRx, and I'll start a little bit from the beginning, just so that I can just do a bit of ground rules really. I just want everyone to keep their mics off during the presentation, just so that there's no feedback that comes. The other bit of housekeeping is that if you want to communicate, just use a chat. There's a chat icon. So on that, feel free to ask questions as we go along, and I'll try to either pick them up as we go through, or I'll cover them at the end. Anything I don't cover, I will aim to put together an FAQ, and we'll get that sent out to next meeting. So if you can hear me, you can just give me a quick wave so I can just confirm that's all going okay. Good. Okay, so what I'll do first of all is that I'm going to just start from the beginning and just go through what it's like to set up AccuRx, and if you haven't set it up, what you need to be doing. So I'm just going to share my screen. So here's my screen that's being shared now. So I'm sharing my screen. You should all be able to see the EMIS window. What I'm going to do to start with is just guide you through how we install it. So for those who haven't actually installed AccuRx before, it's relatively straightforward. There's the website, so AccuRx.com is the website to go to, and once you've gone to that website, you'll get this page, and if you click on Get Chain in the top right, it will then go through a series of steps where you can easily install it. It's really, really simple. The developers have made it absolutely user-friendly to use. So I'll just click a few things here, clicking on EMIS, and then it will go through what you need to set up within EMIS itself, and this needs somebody with admin rights to do this initially. And once it's all set up and it's installed on your system, you'll then see this toolbar in green that appears on the top right of your screen, and this is what allows you to do various functions. What AccuRx does really, really well is it links to the patient that you've got open clinical record. And one of the things that we need to really be careful about is that some people have 2 or 3 windows open at the same time, particularly if you're using just monitors, and you need to be careful about not having several windows impact from here. So once you've got the toolbar open, there's several things that you can do from here, and I'll start off by just going through the basics. Clicking on this icon at the top here will allow you to open up the basic SMS function, and this is really straightforward in terms of you've got a patient text box here. It'll pull in the patient's mobile number up here as well, and sending a message through to the patient will just so you can just send that quite quickly to patients, and also save it into the clinical record. So if I just do that as an example, and then if I just reload the record, you'll see that the message I've sent will come straight through. The other really good functionality here is templates. So a lot of practices now have templates where they can set things up to just automatically send pre-designed messages to patients. And the way to do this is if you click here to search templates, there's a whole load of templates that AccuRx have provided themselves. And the other thing that you can do as a practice is create your own set of templates as well. And it's really straightforward in terms of how you would do this. You just click on a template and it auto populates the message text box quite easily. So that's a quick way of sending messages to patients. Now, often we get asked, how do you set templates up? And it is really easy to do. And the way you would set up a template would be if you click on your name or your initials up here, and you go to manage practice, it'll open up a window where you can then manage templates from here. So if I click on this box here, you can have a look at your practice templates, and you'll be able to easily edit anything that you've got previously, or you can create a new template. You can give it a title, put down the message, and add a code to the message that auto codes back to your system. So that's a really good tip if you want to create your own templates within AccuRx as well. I'm just going to go back to the window here and just show you some other features that are also available. Under templates, there's some other things that you can also do. So you can have some NHS UK information sent to the patient. So if I just put in knee pain or exercise for knee pain, it'll just have a message that'll link to the NHS UK webpage and provide a link to the patient that the patient can then open up. And that's quite a quick way of sending other messages to patients as well. You've got other options at the bottom, and these some of these are new. So you've got, if you are out of hours and you're sending a message, it'll delay the message by default, but you can uncheck that to send the message straight away to the patient. The other option here is now there's two new functionalities that have come in, and one of those is that you can allow the patient to now respond, and currently it's set to one response back from the patient. So I'm just going to discard this one and start a new one. So if, for example, you send a message to a patient, has your leg infection improved? And if I send that message to the patient and allow them to respond, this is effectively how this works. So I'm going to send that to the patient. I'll get a message to say that this has been sent through. Now, what I can do here is I'm just going to put this into a window here so you can actually see what the patient's response is. If I can do it directly. Okay, so this brings up a window that I can then communicate back to the practice. So here, this is the patient's view on their smartphone. And then I'll just click yes to proceed. And there's a verification that's provided, which is the patient has to put in their date of birth. So I'm going to put in the date of birth of this test patient. And then it displays the message that I've sent and the response that I can send back to the patient, to the practice. So I'm the patient responding, yes, much better, thank you. And then as the patient, I can then verify that I'm going to submit that back. And that's delivered back to the practice. So if I now go back into EMIS, the way that we know that that's been recorded is that I will just update the medical record of the patient. It'll take a bit of time for it to flow back into the patient's record, but I'll get a notification that a message has come through to the patient, come through to the practice from the patient. Okay, so the patient has responded to that message, and I've got a notification here that can be seen by other members of the practice team. If I click on that, I can see that the patient's response has come through there, and I can then save to the record. So clicking save to the record will then put that into the clinical system, so that I don't really have to do anything else in terms of manually entering anything in. So that's really, really helpful in terms of a functionality. Okay, so I'll close that down. I'll just show you how it looks like in the clinical record. So that's the message that I sent, and that's the response that came back into the medical record. Okay, so that's an example of templates. There's one other functionality which is now live in AccuRx, but is being rolled out across practices, and that's the ability for practices to send documents to patients. And again, this is with a verification of the patient's date of birth. And this is really useful if you don't want them to come into the practice to pick up documents. you can email that or send it via SMS to the patient directly, and it sends it to them in a link form similar to all the other messages that come through. The way that you would do this, I've got a demo example here, so I'm just going to share this screen that will give you an example here. So what you will see when this is launched into your clinical system in AccuRx is that you'll see this attach file button that will be displayed. Click on that, will allow you to attach a file to the message. Currently, the way that this is done is that you've got to save the document onto the drive, onto the desktop, and then upload it into AccuRx. I'm sure there's developments going on to try to have that directly from EMIS, but currently that's the workaround for that. But it's really useful if you want to send documents to patients without them having to practice come through. So the next functionality I want to show you is a functionality called Pathways. Now this is a new functionality that really can help people follow patients up without them having to remember, really. So it just automatically sends SMSs to patients, and it's available on this pathway button here. So clicking the pathway, you can have a look at some default pathways, or you can set ones up yourself. So I'll show you the default pathways first of all. So if I click on pathway here, and let's just choose use needs in 2 weeks. So if I click on that, so it'll send a message now to the patient to say, I've made a change to one of your medications, you need to have a blood test in 2 weeks' time. And then a reminder text will go after a defined period of time. So here in a week's time, it will send another message to the patient to make sure that they've had the blood test. And this is really useful for patients who need to have some kind of follow-up, but there's no easy way of setting reminders into your system, and these things get automatically recorded, so you can be quite confident that patients have got the message. And if I just choose other ones, so you can select the diabetes annual review, and it will send a message now, and it will send a message in a year's time. So it's a really quick way of doing messages to patients, and you can also set them up yourself. So if you click on custom, you can do a message one here, and then you can create another message to be sent later on, and you can define when you want to send that message to the patient, and you can extend that as much as you want, really. So there are lots of options for practices to design something themselves. So that's a really good tool that can be used, and is one of the new features that practices can really take. And patients get alerted with practices will get alerted to patients' responses by looking up here at the toolbar. You'll see on my toolbar I've got a red circle next to my initials that says 1, which means I've got one message that's coming, and anybody in the practice can pick that up. So that's Pathways. I'm going to move on to Flory next. So Flory is a new function which allows you to send questionnaires, messages to patients. They will then respond, and it'll automatically get coded into the medical record. So a great feature which has really helped patients just engage and can benefit practices by getting things automatically coded. So I'm going to just give you an example here. So there's some pre-built templates here. This is a relatively new option, and this is being built over time. And if there's something that isn't on here that you want to get built, you can suggest it by sending a message to the AccuRx team. So I'm going to look at the COVID-19 triaging questionnaire, which has come up and is quite a popular one that practices are now having a look at. So here's the message that will be sent to the patient. So I'm going to send that through now. And that's going to get sent through, and what I'm going to do is I'm going to show you what it looks like at the patient end. So let's open up this window here. So this is the message that patients will then receive on their mobile. So due to the current concern, we are screening patients before they come into the practice. Are you happy to proceed? So I say yes. I have to confirm myself by putting in my date of birth. and then it will just go through the questions and it will give you an outcome at the end. So do you have any of these symptoms? Yes or no. If I just say new continuous cough. Are you so ill that you've stopped doing all of your usual activities? No. And then has someone who has tested positive been in close contact with you? No. Have you travelled outside of the UK? No. And that's it. So I'll submit that through, and then it will give, that's going to go through into the practice record, which I'll show you in a bit. And then this is the information that the patient will get. So if you're experiencing symptoms, contact NHS 111, and there's just some advice as to what they should do. So really good tool that goes through questionnaires that the GP and practice don't have to ask directly. If I go back into the clinical record here and load that back through, I will click up here and I can see that there's been some messages back. So here there's some notifications that have come through. So there's a COVID message that's come through into the practice. So I'll have a look at that. And that's the patient that I've just sent a message to. They've responded. So I can now have the option to save that into the clinical record. So I'm going to save to record. And that will link in with EMIS that I've got loaded up in the background. And then if I go back into EMIS, update the record here, I can see that I've got the response from the patient there, and it's automatically put it in. The other functionality that you can use with questionnaires is clinical. So if I go back to Flory and I look at the asthma questionnaire, it's going to send some questions about asthma. So I'm going to send that off to the patient now. So bring that up onto a window for you. Okay, so this is the message the patient will get here. So your GP would like to gather some aspects about your health, and I click yes to proceed. And again, the verification is with the date of birth. And then this is a asthma questionnaire that will go through. Do you have asthma? No. And then it will end it. If I go back and I say asthma, yes. And then it will go through the questionnaires that we would need for our coding. So let's have a look. So how often does your asthma cause symptoms? I'll say 1 to 2 times per month. How often does your asthma cause symptoms at night? I'll say never. How often does your asthma limit your activities? 1 to 2 times per month. And how many times a week do you need to use your reliever inhaler? Just like 1. Do you have any information? Urgently. A smoking status, let's just say current smoker, and 10 to 19 a day. Okay, and then that's it. So I'm going to submit that through, and the practice will review the information. It gives an indication of 28 days that information is going to be reviewed in. So now if I go back into the patient's record, I can see that that's the message that I sent to the patient, and very soon I'll get a notification up to say that I need to review something that's been sent through from the patient directly. So here I can go to asthma team. So I've got a message that's come through, click on asthma team, and here I've got a response back from the patient. There we go. So this is the response that the patient entered in the questionnaire. And now this is the clever thing. I can now save this to record. When I save it to the record, again, it will pull up EMIS and put it directly into the patient's notes. And if I now update EMIS, I can see that it's not only put it in, but it's coded the information, which is really, really helpful. And I can go to care history to show you as well that it's coded it all correctly with the correct codes that will go through and link in with cough as well. So really, really useful tool, and something that can be used to help with practice recall as well. So that's Flory. There's some other ones. There's COPD, flu vaccination invites, and there's some other ones coming through as well. So if you've got any suggestions for that, that would be a really good thing to promote with patients. There's another question that's come up around bulk messaging. So AccuRx is quite unique in the fact that it doesn't bulk message. There are other tools that we can use, iPlato, MJog, for example, that do the bulk messaging. AccuRx is very much a personal, direct one-to-one patient approach. Okay, so let's move on to video. So the video functionality is a new functionality that's available. Now there's lots of really good feedback that's been provided with the video function. I've just made a few notes about what people have said. It's really useful to actually communicate with patients who are at home, or particularly if you want to just have a quick visual check of patients, maybe look at a rash perhaps. It's something that is an option that's clinically led. So it's not something that the patients will say, I want to book in for a video consultation. It's the clinician that decides, I'm going to have a consultation with you. So it's a really useful tool. It initially was launched to send a SMS to the patient and to the clinician, and they both log on to have a conversation over smartphones. That's now developed that you can do it on a desktop as well, and I'll go through that functionality with you now. One of the key things to just note, ideally, if you're doing it within a practice, try to connect your smartphone, if you're doing it through the smartphone, to the Wi-Fi in the practice. And if there's problems with the Wi-Fi, contact IT support, because they should be able to sort this out for you relatively quickly. The other thing just to note, some people are asking about cost of the video through 5G. So if you're using your mobile data, it takes about 5 to 8 megabytes a minute. So for a 10-minute consultation, that'll be 50 to 80 megabits off your data plan if you've got a limited amount of data. But generally speaking, if you've got a large data allotment for your phone, or you're using Wi-Fi, then it's not going to have a big impact. Okay, so let's go through the video. So there's two ways to do this. You can either click on the video icon, which takes you directly to the video option here, which is here, or if you do click on the other icon for SMS messaging, you've got the option there where you can click and join in. So there's two ways to do this. I'll show you both ways. I'm going to call a patient shortly, and we're going to just have a conversation. One of the other things that I'm just going to outline, particularly with video consultations, it's really important, like we do with telephone. It's a bit novel with video, but we should be confirming who we're speaking to, unless you're confident that the person on the other end is the person that you called. So I'll just do this now. So I'll just demonstrate what it looks like on the smartphone first. So I've decided to have a consultation with this patient. I'm going to send them a link. Okay, I'm going to do that again. I think I'll take that back. I think I did something slightly different. I was planning on. I've done the other end. So I'm going to just do this again. So the patient's number will come up here. You put your mobile number here, and it will basically make the connection through both smartphones. If you don't want to do it through a smartphone, if you do N/A, then you can launch a desktop version that I'll show you as well. So I'm going to assume I've put in a mobile number here to start with, because it's easier for me to show you over the screen. And I'm going to send this message to the patient. Then what you'll see on my smartphone, so this is my smartphone, and what I'm going to do here, I'm just going to do this here to connect my phone. So here I've connected my smartphone, and I'm going to join the meeting with the patient, and hopefully I can get this on the other side. So just wait for my patient to join. So, hello. So my name is Dr. Bhatti from Crisbury Health Centre. Can I just confirm your full name and date of birth, please?
Yeah, my name's
Brilliant. And can I just confirm you're in a confidential place on your own to commence the consultation? Brilliant. And I'll commence the consultation from there. And as you can see, there's two ways to do this. So this is the mobile version. One of the other key things that I've learned from this is that you can either look at the screen like this, or you can actually look up at the camera and make eye contact, which is a bit weird, but I think from time to time it's probably worth just looking up so that patients feel that you're engaging. So that's the version with the smartphone. Now, if you want to do that via the desktop, it'll basically look like this. So if you launch it from the desktop, you get this view. So Phil, I'm just going to just close this down and relaunch this again. Is that okay? Yeah, okay. So I'm going to send another message through just to show you how that. Okay, so what I was trying to show you earlier was how it looks like with the view on the desktop. So let's try that again. So I've got NA here as a mobile number. I'm going to put the patient's number here. And then send and save to the patient. So that's going to be sent to the patient as a SMS. And then what I can then do is if I click on the link here, that's in the AccuRx box, this will then open up the window for me. So I will now connect to the patient via this method. So this is dependent on me having a webcam and a microphone. So I'm going to join the meeting and the patient should join. There we go. So hi, I'm Dr. Bhatti from Crystal Health Centre. Just confirm your name and date of birth, please. Brilliant. Okay, and then we can have the conversation here. So this is the view that you'll see when you launch it on your desktop, and that's a good way of doing a consultation. So I'm going to come off this. Thank you very much, Phil. Let's do that. Go back into EMIS. So if I reload the patient record, it'll record every single contact that I have with a patient. So you can actually follow through whenever a patient's been contacted. There's really good feedback into the clinical system to code the fact that a consultation has happened. Here, can the patient change from the front-facing camera to the main camera when they want to show you a rash? Yes, it's patients can switch the camera view round to different to the front camera and the back camera quite easily using the app that runs through a browser. So the recommendation is that patients do it through Chrome or Firefox, which most browsers will support. Let's have a quick look. So works quite well. Change your settings to mask your mobile number. So the when you put your mobile number down as a clinician, so if I've got the patient's number there, and if I do a video and I put in my mobile number here, the patients do not get to see my mobile number, and there's no record of that. The mobile number there is only there to make the link and to send me the SMS. There's no recording of that mobile number, so we can be quite reassured that our number is not going to be either saved in the record or sent to the patient. Let's have a look. It's can the surgery Wi-Fi handle several videos? So there's always a limit. I suppose it depends how big the practice is, but the bigger practices have got a bigger network infrastructure. So that should support. If you do notice any problems with the IT infrastructure, just raise a IT ticket, and that can be followed up as well. So there's a few repetitive things. Thank you so much to Jacob from AccuRx, and I think AccuRx deserve a big thank you for all they've done. I think they've been a massive help make this a success. And the other thing that you can certainly promote to other people, the tool can be used on other systems that aren't supported with the clinical system. By that I mean currently it integrates with EMIS and System 1. Any GP practices that use other systems, or even out of hours pharmacies, secondary care, if they've got access to the spine and they can see the patient's NHS number, they can potentially use this tool as well. So it's a really good tool that's been expanded potentially for anyone in the health service to use as well. There we go. So a question here about, do the questionnaires prompt the patient to act? If we say don't come to the surgery, I think that's very much patient dependent. We can't stop patients who don't listen to our messaging. You code it as a video yeah, I'll show you about coding as a video consultation. So if you are having a video consultation with a patient, you'd want to be coding it as a video consultation. So once I've started a video consultation, I can open up the EMIS consultation module. And under consultation type, it usually defaults to GP surgery, and you can have telephone consultation as well. If you have a look, there's an option for consultation via video conference. It's somewhere in this list. In our practice, we've put it up the list, and if you get somebody with admin rights, they can adjust the order of this list. And if you click on that and you click OK, when you actually do a consultation and you save it, you'll be able to see that it's coded as a consultation via video conference. So that does get coded that way. So if you're doing a video consultation, it's good to code. It's always good practice to code the type of consultation, whether it be face-to-face in the GP, telephone, or via video. Other question about, is this webinar being recorded? The answer is yes, this webinar is being recorded. I'm just going to double check. Yes, it is being recorded. I'll probably edit out some of the bloopers that happened, but we'll certainly get that circulated. Anything else? No. So thank you. So Jacob, who is one of the developers from AccuRx, is also on the line. So I think on behalf of the whole of North East London, I'd really like to say thank you very much to you and your team. It's been a massive assistance to us all in primary care, and we really acknowledge the work that you've put in to this. So thank you very much. Yeah, so stay well and wash your hands is a comment which, yeah, good. So that's the webinar. I'm sure you've all got busy Sundays to get on with, and I'll stay on the webinar for a bit longer if there's any other questions, but if you want to leave, feel free to leave, and yeah, we can get this out as soon as we can as a recording. So thank you very much, and I'll stop sharing my screen unless somebody else wants to have any other queries. So stop sharing here. Okay, so thank you very much. I'm happy to take questions if there are any on the chat. And for those of you who want to leave, feel free. Deserved. Yeah, hospital outpatients can use it. So if you know any contacts in the hospital secondary care or anywhere else, or even in the hubs, they can use this tool, and they can use it by using the patient's demographics, the NHS number, to make the connection. They don't have to have a clinical system that they link in directly to. They can just use the spine version, which is really, really useful. And you can either, if you go to the AccuRx website, there's a chat that you can use to get a bit more information, or you can send them an email. And if you want to go through me, that's absolutely fine. I can copy you through if you've got anyone who wants to use this system. Let's have a look what else is coming through. Lots of accolades for Jacob still, which I really value. A webinar for clinical questions. So, yep, so there are other webinars that are now being looked at. So this technology works. We're using the WebEx platform, very soon, hopefully on Monday, we'll get an announcement by NHS England around Microsoft Teams. And Microsoft Teams would be something that will be available to all NHS staff for free. And my plan is to try and roll that out more widely. So there's that's coming down quite quickly as well. Any others? So repeat the webinar. So we can certainly take on any questions. Happy to do another webinar if any new features come in. But as I said, this is going to be recorded and circulated later on. So can you save pictures into EMIS? You can save pictures into EMIS. Patients will have to send that a different way. So currently the response back, as far as I understand, is that patients will send back a SMS message. If they want to send back pictures, they'll have to use another method for doing that. So for example, using remote consultations to send in a rash, for example, is what we're advocating. And it'll be quite good if you set up a template in AccuRx to say, we've done a consultation, please send a picture of your rash and here's the link. And then you send them a link for your remote consultation webpage, and patients can comment and upload on that. And that's what we're doing in our practice currently. Is there any plans for three-way consultations? Yes, potentially, and I would advocate that we do that with Microsoft Teams. So once that's live and working, we've tested it out, I'd be quite keen to get that rolled out. So we'll certainly look at exploiting how Teams works once it's live. And that would be really good to have group consultations, specialist consultations, and other kind of discussions. You know, the sky's the limit, I think, with that. Okay, AccuRx is the way forward. Would that photo be saved in the record issues? Any GDPR issue? So with all information, if patients are sending us pictures, then it's a good practice to have them uploaded into the record. And if patients have given that to us freely with their consent, then I don't see any reason for us to attach that to the record. Patients are also increasingly getting access to their medical record. So therefore, it'll be really easy for patients to see what's on their record themselves. And that's another part that we'll certainly be following up in terms of wanting patients to get full access to their medical record to make it a lot easier for them if they go to another clinician, for example, to be able to share the record more widely. And there's lots of other work going on separately around data sharing and sharing of medical records. Okay, the three-way consult, which I've covered. Our video consults recorded. So as telephone consultations, video consultations are not recorded at source. There may be some tools that do it, but for the moment, my recommendation is that you just use it as you would a face-to-face or telephone. So if you've got a patient that you're consulting face-to-face, you would write in the clinical record. We're not recording that face-to-face consultation. And similarly, with a video consultation, we're not recording that, and therefore just enter the record details into the consultation, making sure that you've got the consultation type right to say that this was a video consultation. Okay, and there's a note from Ekramol about suggestions for webinar topics. We're looking for webinar topics that people would find useful. I think we peaked at around 90 odd. We may have had more participants on this webinar, but certainly if there's other webinars that would be useful, we'd be more than happy to put something together for you. And I think that's the questions that have come through. I think, yeah, I think I would probably call that a wrap, actually. So thank you very much for everyone who's participated. Feel free to continue to send me an email if there's anything else. But I'm going to close down this webinar now, and hope you all have a wonderful weekend. I'll just keep this open for
bit longer because there's still some people chatting about secondary gear colleagues. So yep, so there's a note on the chat if you want to contact the team at AccuRx to try and get other colleagues from outside of primary care involved. You can either email Becky at AccuRx.com or visit the website directly. Okay, so if that's it, I'm going to, okay, has anyone asked MDU if they accept video same as face-to-face? And I think if we look at other video providers, they do advocate this exactly the same as we would with a normal consultation, that we would document it, and we document clearly that is video consultation, and the consultation is effectively the same but in a different mode. Okay, we need a webinar on consulting from home. Yep, so I'm doing this. I'm at home at the moment, so I've just connected remotely, and apart from one glitch, it's worked fine. So it is relatively straightforward, and I've got guides that I can tweak if need be for anyone else. Good. Okay, so I think I've said twice I've got to end the meeting, so I probably will end the meeting now so that we just don't hang on here. So bye-bye and have a good weekend.